Computer, please.
Got
All
it.
right. Welcome back, everybody, to the third installment of our provider highlight for March Kidney Disease Awareness Month 2026. Today we have Dr. David Bliss, all the way down in LA, and we're going to be talking a little bit about what he does and his experience with kidneys. So, first of all, can you introduce yourself and your role in what role you might play in kidney care?
Sure. Well, I'm a pediatric surgeon, which is to say a general surgeon for kids. And that means that I do all kinds of operations from really the head to the toes, with the exception of heart surgery and bones and the like. So I have a sort of two-pronged experience with kidney issues, which is to say I've been a doctor for 36, almost 36 years now, all of that time really in surgery.
Mhm.
And I am myself a kidney patient in the past. My aunt was a kidney transplant recipient 4 times, and I put and my role with kidney patients has been to um, put in dialysis access of different types. I used to do kidney transplants when I was in training, actually all kinds of organ transplants, and all the way up through about 1999. And of course, that requires a specialty certificate, which I don't have anymore, but which I used to do. So I have some background in it. And now I take care of kidney patients that have, say, kidney cancers or other kidney diseases as well that need operations in advance of dialysis as well.
All right. Yeah, so it sounds like you are the guy who puts in the ports and does the surgical aspect of it.
Yeah, so an example would be, let's say that there, and this happens actually pretty frequently. I'll get a call from the kidney doctors, the nephrologists, and they'll say, we have a new kidney patient that needs some kind of dialysis. And quite often they'll tell me that they want to do one of two types, right? We have
Right.
direct blood dialysis, and then we have peritoneal dialysis, which is the catheter in the belly, which sort of indirectly washes the blood. And interestingly enough, quite frequently that they'll tell me that they want to do the blood version. It's called hemodialysis first. And I will honestly try to sort of talk to families in a more balanced way about both, because speaking from experience as a kidney patient and as the nephew of a kidney patient, it's my understanding from people and my experience directly with patients that peritoneal dialysis patients feel better more frequently. It's sort of more even. There's a lot more benefits in my experience. Not always an option, but I try to give them a balanced view of this, and then whichever they choose is what I will perform. And sometimes it's both, honestly.
Yeah, for sure. So, yeah, like I know that, for example, me, and I'm comfortable talking about this. I know that when dialysis has been discussed, and for a little bit of background, Dr. Bliss used to be my pediatric surgeon. I know when we've talked about dialysis, we've always said that peritoneal wasn't really an option for me because of other issues that I have.
Yep.
And so that it's always a catch 22, right? Peritoneal is normally I've heard from people that have done PD that it's great. Well, not great, but it's better than the hemodialysis because they're able to do it at home and they're able to feel maybe a little bit better. But not for me. I got to skip that, which I'm pretty thankful for. So,
That's actually been a kind of a nice change in the situation for a lot of kidney patients, younger kidney patients.
mhm,
The doctors have gotten better at getting people listed in an efficient way for transplant. And so, like your situation, patients are getting transplanted at around the same time that they would have otherwise started dialysis. Whereas it used to be that you would wait sometimes 2 years at the shortest, maybe 18 months at the shortest,
mhm,
or up to 7, 8 years, depending on your blood type. Um,
right.
like I would say going back to the peritoneal dialysis versus hemodialysis, because that's its own, it's a whole discussion, and I don't want to give it, too short a shrift, as they say. But I think the thing that my aunt would describe if she was still around, and she would be, very, very elderly if she were still living, is she felt much more even over the course of time. I think that was the thing that she really described, because you can now do home hemodialysis, believe it or not, and
Mhm.
you can even travel with it. But I think PD, you can travel anywhere as long as you take your supplies, and you can always get re-upped with supplies anywhere. But what she described more than anything was instead of having these wide swings where she'd sort of feel crummy for a while, then get dialysis and feel crummy for a different reason after dialysis, have maybe a day where she felt pretty good and then start to kind of head downward again. PD was pretty, it's little bumps, but pretty even day to day. And she
Yeah.
could then, tweak it, individualize it. So she actually said to me very directly, she said, if it was up to her and she, had control of this, she would recommend PD to everyone because she said it was for her a very, very different experience and much preferable.
Yeah. And I have a friend too that preferred hemo. Which is because they're deathly afraid of peritonitis, and so I'm like that's very fair, very reasonable,
Yeah, yeah.
and everyone's different. But let's look at, from your perspective, what is one of the hardest parts of living with kidney disease?
Well, I think if we take it sort of in stages,
Mhm.
that's really what informs how you respond to it. So I'll speak from personal experience as well as from being a doctor. I think early on when you're developing kidney disease, there's all this, first of all, uncertainty. How quickly is this going to progress? How severe is it going to be? Am I going to have to go on dialysis? Am I going to be able to get a kidney transplant if I can get, and your mind just spins, right? You sort of obsess about all the various things. And I think number two is you end up very quickly having to make changes in your diet, changes in your physical habits. You need to worry about things that you didn't worry about a whole lot before. Like, am I taking enough fluid? Am I taking too much fluid? Am I eating something that has too much potassium? Am I managing my salt, properly? It can feel very difficult because it's a whole new set of issues that none of your friends, if you're not a kidney patient, will have ever had anyone say to them when they're 18, 19, 20, 25, hey, you need to cut back on your salt intake. Hey, you can't eat a banana. Hey, you can't have cantaloupe, right? Or hey, you can't go out in the desert without enough water because you get in big trouble. There's all these sort of seemingly, you almost feel like you want to say it's silly. It's not silly, right? They're really important things. So I think the early piece is all of that confusion and pressure and difficulty. I think later the experience is it's a lot of being tired. The energy level it takes from you. I think we all sort of take for granted a lot of things, right? We assume our heart's working right and our kidneys and our liver and all these things. And when they're not, and kidneys in particular, you feel very kind of tired, washed out, fuzzy. Your brain can be kind of fuzzy and you can't think as quickly or as effectively as you'd like to. You can be kind of swollen, right? Legs swollen, hands swollen, etc. And it's hard to just sort of participate in all the normal activities that people do on a daily basis. So in that setting, you're getting the phone call from your buddies saying, hey, we're going to go to the coast, or we're going to go to the mountains, or we're just going to hang out at the mall together, and you just don't feel like it, right? Because you feel kind of yucky, and it may be visible to people, but it's also one of those illnesses or set of illnesses where, yeah, people can look at you and see that you don't feel great, but it's not like a big open wound or something that people go, oh, a broken bone. Oh yeah, we see you can't walk because you got a broken bone. I,
Mhm.
I think kidney disease sort of sneaks up on your friends and your family because 6 months ago you were okay, and 6 months later you're doing not so great, and 2 years later you're in full kidney failure, and people don't necessarily track that it's progressing. They sort of don't understand that you're feeling less well and less well. And then there's all kinds of other goofy things that people don't necessarily know about or talk about, like it affects your gut. Your appetite goes away or gets poor. You have nausea, you might be constipated or have diarrhea, or whatever the sort of effect on you is. And a lot of sort of normal social stuff that you would do in your 20s. And so if I can be blunt, dating and all the related stuff becomes much harder because you just don't have the physical and emotional and psychological capacity to put that intense energy in that's required to build relationships, particularly with an intimate partner and that sort of thing.
Mhm.
um, I think once you're into full-blown kidney disease, however you want to define that, chronic kidney disease at the level of needing a transplant or even getting a transplant, it's you honestly sort of enter into this world where you're in the hospital a fair bit, whether it's for treatments or visits or because there's lots of meds. I mean, I would say the average patient at that point is probably on 10 to 12 different medications minimum, and sometimes upwards of 20. And so that's a big chore. The doctor visits become routine. It's, weekly or even more frequently than weekly. You get to know your nephrologist really well. And which, by the way, as an aside, better have one you really like and trust, because they're going to become like your best buddy in some respects. And then and you end up, honestly, I think, migrating your peer group, because like a lot of things, it's inevitable that because you're having this experience, you're going to want to have people that share this experience, right? So you often, and I don't mean this in anything other than good, you're going to sort of tend to drift away from the entirely well community and drift towards folks that have kidney disease or other like things, because that's who understands you, right?
Hmm.
When you say, yeah, today's a between dialysis day and I don't feel great, everyone goes, yep, I completely
Yeah.
get that. And there's a shorthand that you have with people. And again, I think because it's not an overnight thing, it doesn't so much sneak up on the patient, it sneaks up on everyone around you,
Hmm.
right? And I think that's hard for people to understand, because most people conceive of illness as one day you're healthy and the next day, everything's falling apart. And that's not kidney disease. It can be. I mean, certainly you can make your kidneys disappear overnight, but for a lot of people, it's really this kind of slow slide, right?
That's how it was for me. I mean, it from being diagnosed at birth to now, oh man, it's so much different. Even, and I'll speak on behalf of the transplant too. I mean, there's a whole different set of stresses and things. Like if I'm not within 5 minutes of taking my meds on time, I start panicking because it's like, oh my goodness, I'm gonna be late and I need to take these meds like right now. So,
Well, and again, we can sort of go deep on the transplant thing, but I'm sure you're going to talk to a transplant nephrologist, so I don't want to steal
mhm,
their thunder. But that's a very delicate process, right? You have to have enough of your immune system knocked down to keep the kidney and have the kidneys, stay out, invisible to your immune system and not get attacked. On the other hand, all that stuff also makes you more subject to getting certain kinds of infections and even cancers. And so,
mhm,
you've got to be, hitting your targets and getting your levels to the right level and staying at that level and not going too high, too low. It's stressful and difficult.
mhm. It's like
And
walking a tightrope.
well, and also I think, look, there's no 25-year-old, for example, that wants to feel, well, I would say this, there's nobody's north of 12 that wants to feel like they are an unhealthy person, right? They don't want to define themselves that way. At 20, 21, 25, 27, you want to be out doing all the stuff that people your age do, and not feeling like, man, I got to be on this tight schedule. I got to get these meds in. I got to have my labs done. I've got to, that's old people stuff, right? Like
Right,
my if you see me with a pill box taking a bunch of different pills every day, you kind of go, yeah, I mean, doesn't sound like fun, but nobody's surprised, right? Uh,
right.
and I think the whole world makes room for that. You're 25 and you say to your friends, hey man, you got to hang out for a few more minutes while I take all my meds and do whatever, daily tests I got to do on my blood sugar, on whatever. They're like, dude, let's go. And you're like,
Hold on a second. Yeah.
this is not like I don't have a choice. I can't like
Right.
skip my tacrolimus or my cyclosporin or my azathioprine. Nope, that's got to happen.
Yeah. Right. If I want to keep the transplant and I want to keep it healthy, I gotta do what I gotta do. Yeah.
And by the way, some young people, not so much in your age group, but in a younger age group, the teenagers will actually, not intentionally in the sense of wanting to give up the kidney, but they will lose their kidney because they'll stop taking their meds.
Hmm. Yeah. It gets hard. I mean, I got my transplant when I was 16
Yeah.
and it was hard trying to keep track of it all, doing school and all that, and having the peer pressure of people, come on, let's go. We gotta go and do this because we're hanging out and that's what we're doing today, and trying to get ready for school and oh, I forgot my meds. Now mom has to come bring them to me. And
Yeah.
it's hard. It's a lot of pressure.
Well, and it's also, I mean, it's seemingly stuff that people at my age would probably label silly, but I think looking back at when I was in your age group, you're gonna want to do some stupid stuff, right? And by stupid stuff, I mean like, go somewhere you shouldn't go, eat something you shouldn't eat, drink something you shouldn't drink, whatever it is. And you just got to be that much more careful as a kidney patient where you say, all right, well, does this affect my meds? Does this affect my kidney? Does this affect my overall health? Am I gonna pay for that? Right. And so, that kind of pressure and limitation is probably the right word, is tough because the typical 20 something wants to say, well, if I want to go have a few beers, I want to go have a few beers, and I don't want somebody to tell me otherwise.
Mhm.
And maybe that's not a great idea, right?
Right. Right. Yeah. And it depends on the individual's body and what your body can handle and what your body can't handle.
Yep.
Like one of our sponsors, the Eagles, is a bar.
Yeah.
And I go there with my friends every so often, and I sometimes have to go, hey, number one, you have to drive home, right?
Yep.
Number two, from a kidney patient standpoint, it's like, no, you don't realize how much water I have to drink to counteract this. Like I can't drink anymore, or else I'm gonna be up all night drinking water.
Yeah, because if it runs through you like it does, right? It's
Yep.
what's called a diuretic. So now you're going to lose water, and now
Hmm.
you got to, because if you get dehydrated, that's a big hairy problem, right? So
Hmm.
it's all these goofy things that the good kidney social workers and doctors and nurses and stuff will educate you, but it's a mountain of information to take in when you're first getting a
Hmm.
kidney transplant, or for that matter, just having kidney disease. I think each one of these experiences is okay. Well, I got to pause and ask, is there anything about what I'm about to do that could affect my kidneys? And
Hmm.
if so, how much of an effect and how much risk is it? Like if it's a 1 in a million risk, okay, well, maybe that's not so bad. But if it's a 1 in 2 risk that it's going to do something serious, mm, that may be an experience you're going to have to let go, you know?
Yeah. What's Here's a question I have for you. What's something you've learned from patients that has changed how you practice?
I think in general, it's letting the patients drive the bus more than having the doctor drive the bus. And when you're a younger doctor, you're really eager to sort of be in not necessarily control, but to
To
be
practice
confident.
medicine.
Yeah.
Yeah.
And what you learn over time is the best results come when the patient themselves is really the partner in that decision making, or is leading even better, right? So if I say to you, going back to the whole dialysis access thing, if I say to you, hey, look, we're going to put this tube in your body to do blood dialysis, a hemodialysis catheter, and I don't say much else, I'm not really partnering with you. I'm just telling you what we're going to do. If I say to you, hey, there's these two different ways we do it. Here's how they're done. Here's how it feels. Here's some people you can talk to that have done one or both. Um, you know, here's some information for you to read, or places you can go read it. Look up about it, and then get back to me or ask me questions, and then we'll do this jointly. And then I generally finish and say, I don't have a dog in that fight. I'm not here to tell you there's a right way. If you ask me my opinion for myself, because I'm a kidney patient, I will tell you my opinion, but that's for me. And then let that person make a good decision. Um, it's hard. I will tell you that the hard part as a physician is watching people make decisions that you worry about. In other words, for example, somebody doesn't want to go through a treatment that's clearly going to help them, right? Um, but that's their right. And
Yeah.
one thing you learn to do is say, okay, I want you to understand my concerns for you and what might go wrong with that approach. um, I, I don't know everything, and I'm not always going to be right, so you may turn out to be right and I may be the one who's wrong here, but I just want you to hear my concern. And then they make their decision, and everyone has to sort of then um, live with it. I think that's probably what people have taught me. And it's funny because it's really honestly reminds you what they teach you in medical school, which is people have control of their bodies. That's the law, not to mention just sort of nature. And
Hmm.
the more you recognize that, and the more you give people that room, the more they participate, the more they understand, the better they're going to do anyway,
Right.
generally. Right.
Yeah. Yeah, that's something I always appreciated about you and Dr. Jenkins is giving me the choice to say, "Hey, what do you think?" Even if I was really really young, right? Always saying, "Hey, what do you think, dude?
Mm-hmm.
How do we
Mm-hmm.
how do you want to do it?" Right? And so even as a pediatric patient, it's important because you can talk to the parents, right? But the parents don't know what it feels like either,
Yeah,
right?
yeah, yeah. I know. I think that's right. I think, particularly, look, I think every young person would like to be treated like a full formed, human, right? And I remember when I was a kid feeling like if somebody ignored me, right, the doctor, or talked to my parents and didn't talk to me, I found that super irritating. Because even at 15 or 14, I'm old enough to understand what's going on, and
Right.
you can explain it to me, and I can ask questions and participate. I may not get the option to make the final decision depending on what state I'm in, because the laws are different state to state. But um, but gosh, I mean, isn't it? I'm going to grow up in case of kidney disease. I'm going to grow up with this, right? It's not going away.
Hmm.
So, pay me now, pay me later. If you educate me now and you work with me now, I'm going to be a better patient when I'm 20 and I'm 25. And if they're new to it, if somebody comes to this at 20 or 21 and now has developed kidney disease, I don't think it's any more or less disruptive than it is if you develop it at 2 or 15. But there is sort of this funny thing where, gosh, I'm just finally an adult and I'm finally ready to make, all my own choices in life. And now all of a sudden I'm put in this position where I'm like being treated like a child again.
Hmm.
So I guess the trick is somehow to find the right balance of, hey, I'm going to guide you because theoretically I have something to offer in that regard, right? I know some stuff, but I'm also going to step off when the time comes to say, okay, you've heard everything, Dakota, what do you want to do? Or whoever the patient is, and then be cool with it. And let's move forward together.
Hmm. Yeah. Yeah. And it helps having good support people too.
Absolutely.
That definitely helps because, if you don't have a good support, it's hard to make those decisions too. And having, in my specific experience when I was younger, I'm sure, you know that my mom was really involved and really, you know, into helping me make the good decision. So,
Well, I mean, look, you've lighted on, I think, honestly, a really sort of important piece of this, which is, you know, having a community around you,
mhm,
however you define that, right? And I purposely don't say family because not everyone has a family, right?
right.
And I think, a community of people that can both be a resource to you, like, hey, I got to bounce an idea off of you, that can support you when you need transportation, when you need, somebody to make medical decisions because you're not in the good enough shape to make those decisions, who can help interpret what the doctors are saying when it's just too much for you, is a gift, right? Because not everyone has that.
Mhm.
And I would say, by the way, for the Northwest Kidney Connections, this is actually, I think, a pretty critical difference for your age group as opposed to Northwest Kidney Kids. And this is not in any way a negative. It's just to say the difference of where people are in different ages. For young people under the age of adulthood, the expectation is, well, ultimately your parents or your guardians are going to make the decisions, and unless you're a ward of the state, there's kind of a pattern. But there's a lot of people once they reach their 20s that for 100 different reasons have either no strong family connections. They maybe don't have a relationship with their parents anymore, or they never did. Parents may have passed away. um, Other family members may be geographically super far away. They may have moved across the country. So there's not the immediate obvious community to say, hey, who's coming to my appointment with me, right? Who's going to drive me home after I have a medical procedure because I can't, do that. I'm not safe to drive.
Right.
um, who's going to, get my meds if I'm, unable to make it to the pharmacy or to the hospital to get those meds. If there's procedures that I need done at home, things I need done at home that I can't do all by myself, is that going to have to be a home nurse, or do I have a family member, friend, community member that's going to pitch in? I don't think that's obvious and nor necessarily immediately available to a 21, 22, 25-year-old. I mean, example, in my case, from 18 to 22, I was 3,000 miles away from my family. and my family wouldn't have had the resources to come out there and take care of me. I would have had to come home, or I would have had to, be cared for by friends and community members there, right?
Yeah. Yeah. It makes it harder, when you don't have that system too, to kind of, I feel like speak up and say, hey, things aren't going well too, in my experience when I'm in the hospital alone, now that I am no longer in pediatrics and they say you can't stay with them anymore. When the doctor comes in, I often will miss things,
Yep.
or I'll be like, oh man, I should have asked him that. And they
Yep.
already went by, and now maybe they're in surgery and they can't answer my question now, you know? And
Yep.
so one thing that I want to ask here is how can patients feel more confident speaking up or asking questions?
Well, I mean, I always tell people the first thing is if you don't feel confident asking somebody like me a question, it's because one of two things is happening. Either I've given you the vibe that I'm not accepting of that, which is on me, not on you, or you've come to the opinion, either you're by yourself or because people taught you this, that it's disrespectful, or you shouldn't challenge the doctor, or any question is challenging the doctor. And that's understandable. I think a lot of people are raised that way, and a lot of people just sort of generally believe that. And there's also a lot of doctors who frankly put out the message, hey, I'm the expert here, you should just listen to what I have to say. And frankly, if I ask you whether you have any questions, it's not really because I mean for you to ask me questions, I'm just doing that because I'm supposed to. So if that's the case, that's the wrong doctor, period. I mean, they could be a great doctor for what they do, but the problem is someday as a kidney patient, you're going to need to ask a question. And if you're not comfortable doing so, something's going to get missed, because somewhere in there there's a disconnect where you don't feel comfortable, and they're not inviting you to do that. So I think for the person who comes into the, like, if as a kidney patient, if you haven't even met the doctor yet, and you're already feeling intimidated, I can't speak up, I'm afraid, or you're just that, you're sort of a shy or timid person, I think you are going to be really well served by the first opportunity to say to the doctor, I feel very uncomfortable bringing up issues, and I feel like that's challenging you, and I don't want it to feel that way, but I don't want to let my worry about that cause us
Mhm.
to miss something. Help me understand how best to communicate my fears and questions and concerns and doubts when they come up, because I want us to work, to the best of both of our abilities to make sure I'm well. Now what you're saying is, number one, we're partners. Number two, you're acknowledging that you have a degree of discomfort. You're inviting that person in to give you a pathway to express yourself. And then I think the follow up is this: if the person says, "Well, I don't know, just speak your mind," which would be quite common, they're going to say that, right? Like, that's what your friends would say. Yeah, just speak your mind, Dakota.
Right,
It's a problem. Well, you wouldn't have said that if you could speak your mind.
right.
So you say, "Well, I wish that were easy for me. It really isn't." So, do you prefer that I communicate things to you in person, verbally? Do you prefer that I send you emails? Do you like, written letters? Do you like a phone call? What's a good way for me to make note of my concerns and bring them to your attention so that we're both comfortable? And
Yeah,
that way they can't just wiggle out by saying, "Yeah, just speak your mind." And
right.
they say, "Well, whatever you like, whatever you feel comfortable doing, you should do." And then you have to pick. You have to say, "Okay, well, then I'm going to pick email."
Hmm.
Because I think most people, and again, let me sort of qualify that. Everyone uses email to some degree or another, right? It tends to be your age group is not in love with email. You guys tend to use, other communication tools, right? Whether that's Snapchat, TikTok, whatever. But and most doctors don't, frankly. Um, but I think everyone knows email. Everyone knows how to use it, and as much as it's not super popular for people in their 20s and 30s, it is a legitimate way to communicate nowadays. And so for the shy person, the person who's intimidated, it's an easy way to put stuff down without feeling like you're being confrontational.
Right. Yeah, I one thing that I've definitely had to learn being a kidney patient is how to use my chart and email
Yep.
to communicate with my physicians how I'm feeling. Um, like for example, my infectious disease doctor, amazing, absolutely love him. I use my chart so much to communicate with him because that's what we have found works best
Mhm.
for him to respond to me in a timely manner and get things done in a timely fashion,
Right.
because he has so many patients. And so if he has a physical, because I'm usually pretty flexible. If he has a physical thing in front of him, and I think if you're a pretty flexible person working with your doctor on what kind of communication works best for them too is important too.
Mhm.
Um, like I know I could always call you or um get a appointment with you and talk to you about things that might have changed if we needed to do that. And that always seemed to work well for us. And with Dr. Jenkins, it was kind of the same way. But with a lot of my physicians now, I'm noticing that email really is the tool that they use, and that's something that I had to learn how to use.
Yeah, and when I say email, you bring up a good point. Really, that's also the kind of messaging system within the electronic medical record, as you refer
Hmm.
to your electronic chart. So, literally today, I was messaging with my doctor, right, and just asking about a medication I'm on, and hey, should I switch this dose? Should I try a different version of this? There's some new meds coming out. Is that helpful? And we had a quick chat by this messaging system, which is really honestly the equivalent of email, super efficient. I know he's not going to be bothered in the sense of if he's in seeing a patient, it's not going to interrupt him, but he's going to see it and he's going to respond when he can, and he's pretty timely. And that's turned out to be a good rhythm for us, right? So yeah, but you got to find somebody that you feel like you can do that with. And by way of example, if that person responds to your email through the portal and more or less is saying to you in some way that this is not okay, then either you got to have a different way to communicate or you got to find a different doctor.
Right.
And,
Yeah.
and that's hard. That's hard.
Yeah. It took me a long time when I transitioned to find a good team for me. I went through a couple of different hospital systems,
Mhm.
and there were a couple doctors that were really, really great, really into the communication thing, and there were others who were just like, I don't know,
Right.
and it's like, no, I can't do the uncertainty of, I don't know, what do you want me to do? Like, well,
Mhm.
you're the doctor, you know.
You're supposed to give me advice and then I can evaluate that. Yeah.
Right.
I would add, by the way, you just made me, gave me another thought, which is, sometimes it's also not just the doctor, but it's the system the doctor works within, right?
Hmm.
So it may be that you have a perfectly good relationship with that doctor, but that doctor is so overburdened in the system that they're in, or they're so inaccessible because they've put up so many, not they, the doctor, but the system has put up so many walls to get into their office or to communicate with them, that
Hmm.
they could be the greatest doctor ever, but just the system is blocking you,
Hmm.
right? And you got to somehow say, okay, well, clearly this system isn't working for me. Now, if you have options, and not all, you don't always have options. One of the small good pieces about being a kidney patient is that um, you're generally covered by Medicare, right? There's a national program to cover the healthcare of kidney patients. So unlike a lot of other young people who may or may not have great health insurance, kidney patients generally have better coverage for this specific condition. But so that gives you some mobility, right? You can move around in systems in ways that, funny enough, if you had liver disease or something, you may not be able to do that,
Hmm.
right? And I'm not trying
Right.
to say it's always easy and smooth. It's just that you do have some options. So, for example, you got your organizations in the Northwest, right? So you think about between Portland and Tacoma, Seattle, and then all the various other places in between, but just picking some of the bigger towns, you've got easily, I would say, 8 completely independent healthcare organizations,
Hmm.
right? Each of which has its own pluses and minuses.
Hmm.
OHSU or University of Washington or Marybridge in Tacoma or Kaiser
Hmm.
or Providence or you name it. And
Right.
each one is going to have some aspects that work better and others less well. You got to find the one that you slot into.
Hmm. Yeah, and for me that was Northwest Renal.
Yep.
When I started going to them, their office at Legacy Good Sam, um, I was like, whoa, this is a completely different, it's a completely different system than the one I was at last time.
Mhm.
Completely different than OHSU even.
Mhm.
And it was just, I was like, wow, this is exactly where it reminded me a lot of being at Dornbecker.
Yep.
And I was like, this is exactly, because Dornbecker worked really well
Mhm.
for for me. And I was like, wow, so this reminds me of Dornbecker where I was, that worked really good for me. So I should probably come here.
Yep.
Because if that worked really well for me then, and this is working in a very similar fashion, then I should probably come here.
Yeah, and it's my sense, and to be a pediatric surgeon, you have to start out in the adult world, and then you move into the peds world as part of your training, and
Mhm.
then you sort of stay there for the rest of your experience. But um, between having been in that world and also on the other side of it as both a family member of adult patients and as a patient myself, eventually, what I think you come to recognize is there's a lot more sort of well designed support systems for patients in the peds world. It's very imperfect, and I'm not trying to paint this overly rosy picture. There's lots of
Mhm.
troubles, but there's the doctors tend to communicate better between across specialties. There tends to be a lot more um, kind of direct handoffs of care. There's good social work, there's good occupational and physical therapy and all these other things that are really pretty well integrated into a lot of pediatric stuff. You get in the adult world and it gets super siloed, meaning people are very separate.
Mhm.
So, yeah, you've got your kidney doctor over here, and you've got the kidney surgeon over here, and you've got the high blood pressure, specialist over here, and you've got the blood specialist over here, and the infectious disease doctor, and they might work in different places, and they might not know each other, and there's no real integration that's built into that. And so a lot of people describe, and I think this is very common, not just for kidney patients, but all patients who are transitioning from the pediatric world to the adult world, they feel like they've dropped into a bit of a black hole.
Mhm.
They're
Yeah,
like, hey, where'd everyone go? You know?
absolutely. So when I went without, well, I didn't really go. I say went without care, but I say that not because I didn't have doctors, but because it was like, okay, I'm in this system now, and everything is so siloed. Nobody's talking to each other, nothing's getting done, and I feel like I might as well not have physicians at that point because nobody's talking to each other and nobody's getting things done.
Well,
Um,
seemingly simple problems can turn into really big ordeals because no one is really the quarterback.
right.
That's kind of the common term that people are using. You don't really have a medical quarterback, right?
Hmm.
So that's as important, I think, in my experience for the patients, is to say, well, who's really going to guide everybody, right? And that might be your family doctor, your internal medicine doctor. It's often the kidney doctor, the nephrologist, but you kind of got to have that conversation with them and say out loud, hey, are you going to be the center point? Are you going to be the person that coordinates my infection doctor, my blood pressure doctor, my transplant, stuff, my general health stuff? Um, if I go to the hospital, are you the person I call to sort of, make sure everyone is doing all the right stuff? Because if you don't ask, they don't necessarily assume that that's their role.
Right. Yeah, that's something that I always appreciated about Dr. Jenkins, is
Yep.
he was kind of my medical quarterback. All
Yep.
right, so this is the situation where we're in, Dr. Jenkins. How do we best protect the kidney? How do we do this in a way where we can preserve, where before transplant it was preserve what function he has left, where after it's preserve all the function he has because we don't want to go on dialysis or we don't want to lose a kidney, right?
Yep.
Um, and so I feel like I found that now in my primary care doctor. where
Mhm.
she's kind of more like, hey, you over here, we need you to talk to you and figure this out. I still see pediatric urology for some things. I see a family practice, uh,
Yeah.
nurse practitioner over at Dornbecker for urology, and she's great too. She acts as kind of a quarterback as well, where she's kind of like, okay, so we have this congenital urologic issue. All right, adult side, this is what I need you to do, and this is how you need to do it, because because th- because the adult side I've noticed too doesn't always get so like my Vater syndrome, they don't always get that that is a huge interconnected thing because there's not a lot of us around that are in
Right.
the adult world now.
Well, they're used to people my age who've had long-term high blood pressure or heart failure or whatever the various forms of chronic kidney disease are, on top of all the autoimmune versions like
Mhm.
glomerulonephritis. But um, so yeah, you're right. I mean, when it's associated with something from childhood, that's a gigantic mystery. Because by the way, if you're going to the well, not so much the family doctor, but certainly the internal medicine doctor, they've got no training in the pediatric world.
Mhm.
So what I really love, just to sort of take a positive note, is there's this sort of emerging, not fully formed specialty of complex care. And there's complex care pediatricians, and I think there's now evolving complex care internists and family practice doctors, where it's people who've done either a little bit of additional training or they've simply just taken on the role of saying, okay, well, I'm going to purposely care for people that have more complex, multiple diseases or long-term disease or transplants or things like that. And if you're lucky enough to be able to identify somebody who's called out as a complex care primary care doctor, man, that's a gem. And I think assuming you have a good relationship with them, that's the
Mhm.
kind of person you want quarterbacking.
Yeah, absolutely. I've developed a pretty good relationship with all of my physicians so far, and that's really been a blessing for me, you know. I know not everyone gets that, and so that's we have a program that we want to start where it's kind of like a, directory where patients can come and put in, hey, this is who I see. I really like them.
Mhm.
Maybe you would like them too if you're in a similar situation.
Yeah. Yeah.
Um, because it's so hard to
Yeah.
find good doctors on the adult side because there's so many of them.
Yep.
Whereas in pediatrics, things are kind of I feel like pediatric doctors, and you can correct me if I'm wrong, because you guys work with kids, it's more of a you guys are a little bit more into it, a little more positive, a little more have maybe a little more emotion, whereas the adult side, they're just like, well, I'm working with adults here, and yeah.
Yeah, no, I mean, my son would tell you I'm like the most overly emotional person he knows, and it drives him crazy. But then I know my son. So yeah, no, I think that's right. I think, people choose pediatrics out of a number of different reasons, but I think there's a component of loving kids and if you're good at it, one of the important things is to be loving and kind and 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 I think be able to communicate with kids and their families. So yeah, you're right, and that's not necessarily baked into being an adult doctor. It's just different. And again, I don't mean that to be in any way negative. My sister's a family practice doctor, and she's fantastic, and
Mhm.
but it is a sort of a bit of a unique world, and so like that's another reason why I think it feels very uncomfortable for the patients when you go from this kind of warm world of pediatrics where people are I think generally caring, generally supportive, and all of a sudden it's kind of all business,
Yeah.
like, okay, yeah, you're a kidney patient, you have high blood pressure, you have this, that, and the other. Here's what we need to do for you, and all of which is great and necessary and that sort of thing. But you'd like to have a little bit more of the sense of being on the team together and having some stake in it and maybe even a little bit of emotion tied to it. But that's not necessarily, that's pretty hard to find. So you have to start with, let's get somebody good, let's get somebody communicative. Let's get somebody that I am going to have a good relationship with. And if you're really blessed, you get somebody that's also
Yeah.
warm, you know?
Yeah. Well, I'll tell you a little story here. The last time I was in the hospital for a kidney infection, this is how I met my infectious disease doctor. And so the the internal medicine doctor, I don't feel like he was exactly ready for the type of condition that I have. You know, personally, nothing against him. I'm sure he's a great provider when it comes to other issues, but he just kind of looked at me and was like, "There's nothing I can do for you. This is gonna kill you one day." And
Oh,
I was like, I don't think that's the appropriate response to
nope.
that, you know? And I told him, I said, I want to see a infectious disease doctor. And
Mm-hmm.
he said, I don't know if I can do that for you. They're really busy. And I said, well, that's what you're going to do because, you know,
Good.
because if, you know, I'm really sick, but if I have to send my mom to your boss, talk to your boss about it, then I'll send someone up there to talk to your boss about it.
Yeah.
And that same day, I had Dr. McCormick come in, and he was like, "Oh no! That's no. This is something we can work with, you know." And he said, I may not deal with your condition all the time, but I deal with infections. That's my whole thing, you
Mhm.
know. And I feel like we might be able." He said, you know, let me talk to Shelly over at Dornbecker, and let's see if we can come up with a plan and
Yep.
see if there's something that we can prescribe that's going to, you know, hopefully knock down your infections. And it worked. But you have to find someone who's willing to not just say, "Oh, well,
Hmm.
sorry, hands are tied, man.
Yeah.
Not much I can do."
Well, I mean, first of all, I'm sorry that that guy said that. It's sort of,
Yep.
or the gal, I mean, didn't catch man or woman, but, I think that, unfortunately, I wish I could say that everyone is going to be the right kind of doctor, and they're just not. So, not everyone is created equal, just like everything else. Not every police officer, bus driver, banker, et cetera, lawyer are all good people. There's some that are great, and there's some that are so, and there's some that are not great at all. But I think it's you demonstrated a couple of things that are worth pointing out. One is, okay, I didn't get the answer that I'm hoping for or that I need, and so I'm just going to keep moving. I mean, okay, you can't give me what I need. Who can? And I'm gonna go find that, and I'm not going to let you stop me just because you have a couple letters behind your name.
Mm-hmm.
I hear you. You may not think this is going anywhere. You may think this is going to kill me. By the way, we're all going to die. You
Mm-hmm.
know, that doesn't mean it's that we're going to die from this particular problem, right? Like,
Right.
Dave Bliss is going to leave this earth one day. Yes, that's a true statement, but I'd like that to be a long time from now.
Mm-hmm.
So let's get there a different way. And thank you, but you're fired, and I'm moving on,
Mm-hmm.
right?
Right.
And be sort of unafraid to do that. I will say what's behind that, and it's worth mentioning is, and it's worth paying attention to when you're interacting with new doctors is, do they see me as a person first, or do they see me as a disease? Do
Mm.
they see me as a person from a certain background, or do they look at me independent of that background? Right. So in other words, if I say to you, and it's not to not recognize who you are and where you're from, but do they make note of that for any other purpose than just to say, okay, I see you? In other words, if I say to you, you know, you're Dakota Watson from Washington State, and the Washington State piece doesn't mean anything to me other than it's just that's where you live and I make note of it. Then cool. If I say, you're Dakota Watson and you don't have a college education and that means something about you, right?
Mm.
Then and I've somehow judged you for that, then I'm probably the wrong doctor because now I'm not going to treat you. Or if I look at you and I say you're a kidney patient who happens to be named Dakota Watson, then I flipped it,
Mm-hmm.
right? Yeah, you're a kidney patient, but that's not the most important thing here.
Right.
Most important part is you're Dakota Watson who likes to play guitar, who enjoys church, who's married, who has a wonderful, loving family, and a couple crazy sisters. No, they're wonderful, but I just they're fun. There's all these other components of who you are, right? Who has kidney disease, who has a kidney transplant, who has all some other medical conditions. Okay, great, that's your picture.
Mm-hmm.
but there's no judgment there. That's just a description of you.
Mm-hmm.
Now, what do you need?
Right.
Okay, cool. Now,
That's
now we're there.
right. And that's something that's also the same stay where I met Dr. Wickham too. And so, and Dr. Wickham's just phenomenal. And they put their heads together, Dr. McCormick, Dr. Wickham, and they said, "Hey, I used to have, as you know, because you put it in the cecostomy tube." And they said, "Hey, this thing hasn't been changed for a while."
Yep.
And Shelley said, "Hey, we did gentamicin a while ago and it seemed to work. Let's do both of those things and see what happens, because he is this, 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 and this. And we got to make sure that he's able to go home to his wife, his family, his, whatever, right? Because he's a human person, and this is not going to get him today. And it hopefully it won't get him ever. And we're going to do everything that we can to try and prevent that.
Yeah, I mean,
Um,
look, it's not that we don't run out of rope sometimes. We
right,
do,
for sure.
but I think you got to have a little sense of, as the patient, but also as the doctor, a little intuition about, hey, does this really feel like this is the end of the line? Because it seems to me that we've got some options. And that's, by the way, where the medical quarterback ends up coming back around, because you go back to your quarterback and say, hey, I just got this kind of bizarre message, right? This person
Right.
told me that I'm past the point of being able to do anything. Does that sound right to you?
Yep.
Because it doesn't sound right to me. And then they'll typically say to you, and so let's take a circumstance where that's true. I mean, if somebody has a cancer that is untreatable for whatever reason, then you have to be honest about that and face the reality of it, and take the steps necessary to move forward through that, but understand that it's not now a cure, right? That does come up, and you have to sort of face the realities, but many times it's what you describe. It's not really that it's the end of the line. It's just somebody's had a bad attitude or had a bad day or is judging you for other reasons, and maybe doesn't even recognize that, right? They just don't like people from Canby. I don't know.
Right, 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 right. Yeah,
And you'd say, well, doctors shouldn't be that way. Yeah, I agree. And there's a lot of things that people shouldn't be. I should be a better person every day of my life, and I'm working on it. But some days are a bad day.
right. I mean, we all have bad days, and even patients. Sometimes not all patients treat their doctors great. And so I try to be one of those patients that
Oh, you're
treats their
correct.
doctors great, and so um, here's a here's a question I didn't put on my list. How do you handle situations like that where you just got a patient that's just not wanting to, listen or do what the doctor recommends, or it
Hmm.
maybe just generally has like a bad attitude or has a down attitude? How do
Yeah.
you how do you deal with that?
Well, I mean, there's different varieties of this, right? So there's honestly, first of all, there's the patient, and then there's the family, because sometimes it's the family that's tricky, and it's the patient's fine, right? And so in some respects, a difficult set of caregivers is harder than is a patient who's having a hard time, because um, I think for the most part can understand when a patient is feeling depressed or angry or confrontational or withdrawn or all these things. I mean, those can kind of make sense. So I would separate it into a couple issues. If I really felt like I was not going to be able to help them, and maybe it's my limitation, I'll say to them, hey, I may not be the right person to help you, not because you are not able to be helped, but because I just may not be the right fit for you, right? So if you would like, I'd be more than happy to find somebody who would fit you better. So I'll give you an example. A real simple one. Sometimes it's being male, and it's a patient who would like a female doctor. Okay, I can accommodate that, right? It doesn't have to be me. I have a female partner. Let me put you in touch with that partner, and we can work on that. When it's an issue of, say, they're angry or withdrawn, or there's clearly something else under the surface that's going on, sometimes I'll call it out directly, and I'll say, hey, I get the sense that there's something here I'm not seeing or hearing, and what is it that I'm missing? And that at least opens a door for them to express whatever it is that they want to express. I don't like you. I think you're a jerk. You don't know what you're doing. Or, you know, I'm sick of being a patient and I don't want to be a sick person anymore. You know, it might be a million different things, but it gives them an opening to speak to it. Honestly, my other strategy is often just get to know them and find some common ground, right? Like you and I had, our common ground was ACDC,
Hmm. Yeah,
right?
right.
So again, people would sort of think it's sort of silly, but right, but we used to rock out together.
Hmm.
So and I don't know. I mean, you tell me, did that matter to you?
Absolutely. I mean, w- I don't think I don't think I can think of anyone else who was maybe like, I guess, excited to go into the OR, right? Because you get that common ground and hey dude, we're gonna go back, we're gonna rock out, and then we're gonna knock you out, and then you're gonna be in pain for a couple weeks, then you'll be okay.
Right.
Right?
I mean, we don't, avoid reality, right? I'm going to tell you,
Right.
hey, we're going to do this nasty thing to you, but along the way, we're going to find some common ground, right? And maybe that's music, maybe that's jokes,
Hmm.
maybe that's where they grew up, maybe it's just being a kid, or being a young person, right? And I think a little bit of humor in the right moment goes a long way. And it's tricky, right? Because you don't want to make people feel like you're sort of trivializing what's going on with them. And some people find humor that feels that way to them. So you got to kind of, feel this out a little bit. But
Hmm.
sometimes it's about being also a little what's called self-deprecating, where you kind of make fun of yourself. And I'll do that. I'll talk about how I'm old or fat or slow or, or that when I was their age, dinosaurs roamed the earth or, whatever it is. And try to find a little humor in my situation. So I'm not making fun of them. I'm not making them feel like I'm treating them as being silly, but just sort of saying, for example, when a patient is in a conflict with their parents, or with a caregiver, right? If they're in their 20s or so, and that sometimes is a spouse, right? And I'll say, well, hey, I feel the tension, and I'll call it out, right? And I get that, right? I'm a married dude. I have a son. I'm not in your situation. I'm not going to claim that I understand what it is to be in the position of, say, a kidney transplant patient. But all these other things, like how to deal with relationships, oh yeah, man,
Hmm.
I can tell you a million ways to do it wrong, right? So,
Right.
and I think when you're willing to sort of share a little bit and kind of be a little bit more of a failed human, right? I hope and I believe in about 99% of the time it comes across as, yeah, I'm in this fight with you. Now I
Right.
will tell you that fails about one in 100, one in 1,000, maybe, where people hear that as me being flip or somehow insincere, or just it rubs a nerve, right? And that's okay. That's all right. And then they need to find somebody else, or we need to dig through that and figure out where I went off the rails.
Hmm. Right. Yeah. So we've talked a little bit about communication here. I want to know how, in your experience, has does kidney disease impact mental and emotional health from what you observe?
I think first of all, if there's a kidney patient around who hasn't felt mental health impacts, then I'd like to meet him, because I think anyone who has a long-term illness, anyone who's a young person who had expectations about life that's been hit with this, anyone who's been through the ups and downs of kidney disease in specific, because it's such a roller coaster, man, you got to be the most compensated person not to have depression, not to occasionally, think about more serious things like even suicide, uh, to not be able to sustain relationships with your family or your intimate partners or whomever, because you just can't give them the energy that you would like to give them. Sometimes you can go to some pretty dark places, right? And the stress level is pretty impressive, right? It's a lot. So um, I would say that's to be expected, which is not to say that everyone around it should just kind of shrug their shoulders and say, oh yeah, well, they have kidney disease, so they're depressed. That's not what I'm saying. What I'm saying is, as a patient, you have to sort of be aware that this is coming.
Mhm.
Um, that that's normal, that you're allowed to do that, right? You're allowed to say, yeah, I can feel depressed, and I can not want to interact with anybody, and I can not want to go to my job, and I can feel like I've been ripped off, and I can be angry at God or whoever you think is responsible for this, or the universe, depending on your faith or traditions. Because if you don't feel those things, honestly, if you don't express them to yourself, they're probably happening. You're just sort of trying to deny them, right? Is my experience. I think for the people around you, it's about recognition, right? You look like you're feeling, down. It's having people around you say just that. Hey, it seems like you're down. What's up?
Mm-hmm.
Don't try to put too much of a label on it. Don't try to fix it, right? I can't. What would fix it is get rid of the kidney disease.
Right. And there's no way to do that, right? And
Right.
so,
So if I can't wave that magic wand as your friend, as your doctor, as your spouse, as your family member, whatever, then what I need to say to you is, hey man, I expect that this is a lot. So what's up? You know,
mhm.
what do you need from me that would help you?
Yeah.
You need me to just sit on the couch and be silent? Cool, I'm there.
Yeah.
Right.
Yeah.
I don't know that you have to have any answers. I think you just have to say, I see you.
Hmm.
I see what you're going through. And I want you to know that I'm here to help you in whatever way that you need. And if you need me to go away because that's what you need, then I'll go away. And I not permanently, I mean, I'm saying like you need me to get out the room or you need me to leave you alone for a week. So long as I'm not worried that you're going to do something that you would, be irreversible, I'm out. All right. Or you need me to be here and leave work. I'm leaving work. What do you need?
Right.
And,
Right.
and by the way, I don't think that's just kidney patients. I mean, many, many, many years ago, when I was in college, one of my couple best friends from childhood, who I'm still super good friends with, and he's actually coming to visit me tomorrow. Um, we just had a phone call, and he heard something in my voice. I didn't say anything to him. He just heard something in my voice. The next thing I know, he's calling me from the airport saying, "I'm getting on a flight. I'm flying 3,000 miles to come see you." And I said, "What are you doing?" He said, "I don't like the sound of your voice. Something's wrong." And he said, "I'm coming to see you." He flew all the way out to Boston from LA for the weekend and just said, "I'm here, man. Well, I don't know what's up, but something's up." And he was right. I mean, I was going through a tough time, right? And it made a huge difference. And it was massive as a friendship thing for him to say, number one, I'm going to make you that priority. I'm going to come out and I'm not asking you, I'm coming,
Mhm.
right? Number two, when he arrived, I'm not here to fix you. I'm just here to be your friend. What do you need?
Mhm.
Right. By the way, for a dude to say that is hard because dudes want to fix things quite often.
Mhm.
I mean, just a huge demonstration of what it means to be a good friend.
Yeah. And I think that's a good point. A lot of the times we spend a lot of time with our physicians and we get to know them. And sometimes, like in our case and with mine and Dr. Jenkins's case and Dr. Bain, my old pediatric urologist, we became friends, really, and so it's I I always look at it like um and I think this is something that you would probably agree with is that, kidney disease has taken a lot from me, but it's also given me a lot.
Yep.
And if I wouldn't have had this kidney disease, I wouldn't have met you, and I wouldn't have met Dr. Jenkins, and I wouldn't have met the amazing community that Northwest Kidney Kids gave me when I was in pediatrics. I wouldn't have
Yep.
had any of that,
Right.
And so I think it matters a lot, your perspective and how you look at it. I think you told me one time, and I take this to heart. If you don't laugh about it, it's gonna kill you, you know.
Yeah, I mean, I think as I sort of reflect on that kind of stuff, I think, I want to be careful and say it's a double-edged sword, right? You don't ever want to tell somebody,
Right.
hey, yeah, you're deep in the dumps and hey, just put on a happy face. I think that's tricky, right? Because,
Hmm.
if somebody's truly depressed, you can't just sort of, make a little simple statement and say,
Right.
hey, Dakota, just, feel better. But I think what you can say is, I know that this is really rough and there's going to be times that are good and there's going to be times that are bad. And yeah, you're right that to the degree that you can say, hey man, this is just part of the life journey I'm on, and I got to kind of roll with some stuff that other people don't have to roll with, and yeah, it's not fair, and yeah, there's times where I'm going to be really upset or angry or depressed, and then I've got to kind of find a way to move through and have other people help me, and then look back at it and say, yeah, but what also came out of this? You know, did I learn something? Did I grow as a person? Did I develop relationships? Did I have experiences that I can look back on that were positive?
Mhm.
Um, Understand that that doesn't wipe away the negative.
Right.
It just helps you find that bit of balance, right?
Hmm.
Like I think, I'll give you an example, from my own background. I had some pretty tough family relationships growing up, and I had my wife say to me, well, would you change that? Would you, if you could go back and change your childhood, would you change it? And I said, well, of course. The angry part of me says, yeah. I mean, I wouldn't want all that stuff. But on the other hand, Dave Bliss is Dave Bliss because he had all those experiences, good and bad.
Hmm.
So butterfly effect, man. You go back and change it, and maybe I'm not the same person. Maybe I wouldn't have been as motivated, or maybe I would be less compassionate, or maybe I would be an entirely different. I don't know. So I got all I can, plus which I can't change it. So I think the kidney situation, you sort of look at it and say, yeah, I'm allowed to be angry. I'm allowed to be depressed. I'm allowed to lash out. I'm allowed to, retreat sometimes, but also that has, contributed to who I am.
Hmm.
So I gotta take that as part of the equation.
Yeah. Yeah. Couple more questions here, and then we'll wrap up here. How can community organizations help fill gaps that clinics can't?
Well, I think you brought up a really good example of that, and I think it's probably one of many. But providing a directory of experience is really useful, right? And that's sort of part of this current era where everybody does a rating. You have your rating for your ride share and your rating for your Amazon delivery. And it sounds like I'm joking, but my point is, the 5-star system can be really helpful to the person, particularly who's new to navigating this whole really complicated new environment of hey man, what places do I go? Who do I see? Why do I see them? I think what the organizations can do to amplify that, to make it even better, is to add as much um, detail and useful, maybe not objective information, but specific information. So I'll give you an example. If you say, "Hey, I'm going to give Dr. Jenkins a 5-star rating," and you guys, I really love this experience, and if you have the opportunity to see Dr. Jenkins, you should. Obviously he's retired now, and so I'm using
Right.
example of somebody who you can't. But and Randy was fantastic, right? But even better than that is if the organization says, well, Randy keeps a small panel of patients, so he's more available. He takes call on all of his patients, and he's routinely available for phone calls. He answers emails within a certain short period of time. His office is super friendly. All those sort of level of detail, because what's going to happen is people are going to look at things that matter to them, that may or may not. And it's funny. Everyone's got their pet peeve, right? Like some people couldn't care less whether the office front desk person is nice or not nice. Doesn't matter one bit. The next person is going to be so upset and intimidated by the front office person who's rude to them that that's going to wreck any experience they might have. So that level of detail is, I think, filling a huge gap that people, because otherwise people don't have a lot of information. You go read about me online, and I think it's pretty boring to do, frankly. But honestly, people give a limited amount of information on there, and I don't go add to it because it's generally been very positive, and so I don't have any reason to change anything. But I would love it if they would say, yeah, we get an appointment with Dr. Bliss within 1 week of asking, right? That's useful data for people to have. Like there's no 6-month waiting list.
Right.
I think second of all, organizations can kind of lay out roadmaps of what to expect based on certain experiences. So, by way of example, what's the kidney transplant experience like? Well, once you get a big enough group of people within Northwest Connections, Kidney Connections, you can start to say, well, there's going to be some people who the kidney worked beautifully, some people where the kidney didn't work at all, some people where the kidney worked to start and then started to fade. Some people have had more than one transplant, but you can start to put together some roadmap information, which then branches into, well, what are the signs of a problem that you need to know about? When those problems happen, is it urgent? Is it not urgent? Is it, should you be, and not necessarily giving medical advice, because you got to be a little cautious about not getting too deep in the weeds and saying, hey, we're going to pretend like we're your doctors. We're just saying, here's some experiences that where we found that, oh, by the way, I didn't realize that, my potassium was going up, but what I knew was that my heart was racing.
Mm,
Right. And oh, by the way, that was a clue. And it's not going to be a clue every time, but this is just an experience that otherwise, how would you know that?
mm-hmm.
Right. I think the other piece is to have not just positive stories, because I think, the internet is full of the beautiful, right? Everyone wants to look at this wonderful meal I ate, and look at how beautiful I am, and look at my perfect family, and look at my incredible car, and whatever. And everything's got to be sort of beautiful and perfect, and your model, your model life. I think having success stories is wonderful, and people need to have something to look forward to, right? Here's the successful, kidney patient. But I think people also need to be able to understand that not all roads are positive, and some roads are tough. And how did people get through that? And
Mm-hmm.
and some perspective from the family members. How did you navigate? Like your mom is a great resource, right? How did she navigate going from a young woman expecting to have, this perfect baby, and then it's all of a sudden there's a bunch of challenges, right? And and how does she navigate that? And what's the impact been on her long term? And how does that ripple out? And how do you maintain the sanity, health, and happiness of everyone else that's around, right? How do siblings keep their sanity, right? How do your sisters would be a great interview, right? Like, what does this look like from this perspective of a sibling, right? How did you feel watching Dakota go through all this, and how did you fit in that puzzle? So those are the kind of things that, because guess who's not getting a lot of attention? The siblings,
Yep.
more distant relatives. So the new kidney patient plus their family can then go and say, oh, wow, hey, here's a younger sibling. Maybe I'm going to get my little, brother to watch a video of, I'm not going to name your sisters, because I don't know if they would, if I
Right.
had your permission to name them. But, if your littlest sister, for example, maybe that's the next person comes along and says, hey, my little sister would really dig seeing how she navigated that and how she was impacted. So, I think, and there's a lot more here. I mean, honestly, we could talk for an hour about this subject alone.
Mm-hmm.
I think what you want to do is go around to this. You have this amazing community around you, right, Dakota? I mean, you're a great guy, and so you've collected people in the way that my mother we used to say, she collected people, and I mean that in the most positive way. Like, people just want to be around you, right? Because you're that force of nature with this really great spirit. So you've got people at church, you've got people from school, you've got people from your job, you've got your family. Go to them and say, what information, what resources, what people didn't you know about that would affect you, as well as going and talking to all your kidney patient friends,
Mm-hmm.
right? What was missing for you that
Right.
would have sped this up, made it easier, made it more successful, made it less stressful, et cetera. And man, I think people will pour out all kinds of ideas.
Mm-hmm. Yeah. Well, one final closing question here. It's kind of similar to one that I already asked, but um, what have patients taught you that stays with you when you practice medicine?
I think that they're far more resilient than they know,
Mm,
right? And given the opportunities to thrive, however you define that, people will surprisingly rally and get through some pretty tough stuff and come out the other side. I mean, look at the situation. Here you are, um, building this nonprofit because you saw a gap in the world and you said, well, why not me? I'm going to go do this. Now, meanwhile, you're doing this, you're still an actual patient. You're still, having to navigate being a relatively newlywed guy.
Right.
Um, you've got other community responsibilities, a job, church responsibility, et cetera. And yet you're doing this amazing stuff. So I think what I take from that is, yeah, you have some medical challenges, but that's not who you are. It's a piece of your life,
Hmm.
but it doesn't define you or necessarily limit you beyond a certain point, right? I mean, we'd be lying if we said you don't have limitations because of having kidney disease, but you sort of looked at it and said, okay, well, within those pretty broad boundaries, what can I do with my life? I think that's taught me a lot about what the future can hold for young people facing some pretty hefty challenges, right? That might crush them if they didn't know that there were these kind of people like you out there that have said, well, I don't care. I'm going to go, yeah, I got this, but I'm going to go do stuff anyway, right?
Right.
Um, I mean, I look at what you've done just in the last 2 years, and I think, man, it's inspirational, and I know that word is overused, but it tells me that you're unique. I would say there's no question you're unique. And really honestly, one of my favorite people, um, but you're a version of what a lot of people can be.
Hmm.
And this community has the opportunity to buoy people up, lift people up, help them, realize their full potential, build a broader community that supports each other and can accomplish some great stuff. And so the lesson I think for me is I'm a facilitator, right? I don't actually, how do I put this right? I hope I make that people like me and doctors in general give you the opportunities by virtue of taking good care of you, but it's you guys that then make something of it.
Right.
So we facilitate. We help you see the pathway. We help you know move you down the path, ideally in the right direction, and then you guys go do whatever cool stuff you do. Super life affirming and gratifying for us as doctors. Like that's just why we do it,
Hmm. Yeah.
right? I was literally talking about you today, not joke, not by name, of course, but just in principle, and just saying, because we were talking about an aspect of Voctral as it happens in a teaching conference. And I said, so let me tell you, you can think whatever you think about as you're looking at this little baby who's Dakota Watson 20, what is it, 22 years ago now.
Hmm.
Um,
24.
4 years ago. Holy cow, track of time. You know, and there's some really good outcomes out there of people doing really cool stuff.
Yeah.
So as doctors, I said to doctors, that should tell you that we've got work to do and we've got good stuff to do.
Hmm. That's right. Well,
Other questions I
thank,
can answer for you?
I don't think so. We talked about a lot, and I think this is really good. Thank you so much for taking, hour and a half out of your day to come and speak to our community and um, help help us kind of bridge a gap in our care a little more. Um, so that will include our third or conclude our third installment of our physician interviews, and we will see all of you next week. Uh, thank you for watching. Bye bye.